As Karen had earlier mentioned, we are actually in year 4 of our CDC U54 grant, and one of the other grantees on this project is called UFO Presents, and they have a very innovative model that looks at hepatitis C, working with substance abusers, and their project is actually being done in California, and we're very fortunate today to have Pam DeCarlo, who's the project director, who is here to share with us the best practice model for Hep C. So thank you, Pam, for being here.
Hi, everybody. My name is Pam DeCarlo, and I'm the project director for UFO Presents. And I'm going to take you on a little bit of a different ride. I'm going to talk about the UFO model, which is specifically for hepatitis C prevention and education for young adult injection drug users. So first I'm going to tell you about the UFO study and UFO Presents, and then I'm going to talk to you about the UFO model intervention, and then we're going to talk about how it can be adapted to fit to different communities. One of the cornerstones of the UFO model is creativity, and I've heard that coming up all over today. Young adults are very creative. They're creative in how they support themselves, how they use drugs, how they relate to adults. So we have to be really creative in how we serve them also. So the UFO model was born out of creativity by the researchers, by staff, and by participants. So I just wanted to give a shout out to creativity. Case in point, have people heard the newest substance use trend among young people? Drinking hand sanitizer. Has anybody heard that? Yeah? Yeah. So whether or not it's actually a trend among youth is a question, but that's pretty creative, drinking hand sanitizer. So what are the UCSF UFO studies? It's based at the University of California, San Francisco, and there are a series of research studies with young adult injection drug users, and they've been going on for about 15 years. We look at risk behaviors, overdose, cessation, relapse, gender differences, acute infection. When we started out, we were just doing simple epidemiological research. We were counting how many of the young injectors had hepatitis and HIV. But we soon realized that in order to both get young people in and to keep them coming back, we had to offer a lot of services. And as we learned more about our participants through our research, that, for instance, 73% of them had ever witnessed an overdose. So that research made us add different services. In this case, we added overdose prevention training and Narcan distribution. So the young adults weren't coming back just to take a 45-minute behavioral survey. They were coming back for the whole UFO experience. So how it fits together, we have these series of UFO research studies, and they are ongoing. And the services came out of the research, and then the services feed our model. The UFO Presents project is creating this replication manual, website, and TA out of the services that we delivered with the research projects. That was simple. UFO Presents. In 2008, the CDC's Division of Viral Hepatitis funded us to do the UFO Presents project. And it allows us to turn all our years of experience working with young adult injection drug users into a model intervention, which we call the UFO model. So we have a replication manual, a website and training, and technical assistance for agencies across the US who are interested in implementing this model. And as part of our work, we've been talking to agencies across the country to learn more about young adult IDU, and we've heard really similar stories in a lot of cities. They tell us they're seeing increases in young people entering drug treatment, attending syringe exchange programs. They're seeing increases in cases of Hep C and overdose among young adults. And this is where the UFO model can potentially help. We're currently testing our replication manual and TIA products in Sacramento, California, and Newark, New Jersey, to help make it more user-friendly and relevant to diverse populations of young adult IDU. So what is it? It's an intervention specifically designed for young adults who inject drugs. It has 6 components that can be used all together or in different combinations. It works on the individual level, outreach, counseling, and testing. It works on the group level with our support group. and on the community level with a drop-in center, linkages to youth services, and syringe access. And as we've heard, young adult IDUs are at risk for a number of negative outcomes, and we have a small window of opportunity to intervene. The UFO study has found that within a year of injecting, 20% of all young adult IDUs have become HCV positive, and within 5 years, 45% are HCV positive. So the time to act is now. This is why we focus on young adults. We were in Newark recently and talked with a young man who came to the syringe exchange there. He's 21. He lives with his parents. He has a job in construction. He drove a half an hour from the suburbs to get to the exchange. He got hooked on prescription pills, OxyContin, and then started injecting, and he's been injecting for 2 years. His parents knows he uses because he went through drug treatment, but they don't know that he's relapsed. Before he came to the exchange, he used to reuse the same needle until it broke off into his arm. And he told us a story of how that happened to him once, and his arm swelled up to the size of his leg. And he was really concerned because I had a hard time figuring out how to hide that from his parents. So luckily, the last time he was tested, he did not have hepatitis C. Which brings us to the UFO model. The components are outreach and education, youth-centered referrals, drop-in center, syringe access, counseling and testing for hepatitis C and immunizations for A and B, and an 8-week education support group. And these components, they represent sort of the Cadillac version, or perhaps the Prius version if you want to be more eco-friendly. We know that not every agency will be able to implement all 6 components, and not every agency will have the same kind of participants that we see in San Francisco. But we get it. So we designed the UFO model to be modular, flexible, adaptable, and throughout all that, creative. And more detail on all of that stuff, things I'm talking about, the UFO model and everything, is available on our website, www.ufomodel.org. You might hear that later on today also. So no matter how creative you may get adapting the UFO model, these core elements are what's necessary to make sure that they're still effective. So harm reduction, we are non-judgmental and we're non-punitive. Young adults experience enough of that already. We assume that young IDU can and will learn, but can understand complex issues, and they can change their behaviors in big or small ways. Outreach and consistency, experience equals respect. Week after week, rain or shine, through earthquakes and natural disasters, we're out there. Consistent presence builds trust. Let me tell you another story about a young man who's a participant at UFO in San Francisco. He left home with his messed up family when he was 13 years old and started riding the rails. When he was 15, he had escaped from a horrible foster home, and he was walking along the highway at night in Oregon. He felt like he was having a heart attack and he was going to die. He was actually having a panic attack, which is not unusual for people who live on the street. And he saw a sign that had a kid and a door on it. So he followed the sign and walked into the building, and a woman there who was on staff put a hand on his shoulder and said, "Are you okay?" And it was the first time anyone in his life had ever said that to him. And he talks about that encounter as saving his life. So being there for young people, showing compassion, and being accepting, those are all excellent ways to work with young adults. The first component of the model is outreach and education. We have a written outreach strategy that we start with that's based on what we know, our needs assessment, and what our participants tell us. So we create a recruitment area plan. It's a chart that lists the neighborhood, specific streets and areas in that neighborhood, what other agencies are operating in that area, and which outreach workers go out there and at what time. And why don't I let Nikki and Giuseppe tell you more about our outreach. Or not. Hang on. Okay, it worked a minute ago, but I don't know if it's going to work now. What you may see in a few seconds is we've created some video tutorials that are up on our website. not gonna work right now. Wait, what? That's- So we'll just pretend the black screen is that. So anyway, we have some video tutorials that are up on our website, which I was going to show you a little snap of. We have one on outreach and education, one on hepatitis C rapid testing, and one on the differences between hepatitis A, B, and C. That you'll see some other time. All right, component 2 is youth-centered referrals. We can't do it alone. Everybody's been talking. Dr. Ward said in the morning, we need partnerships. Everyone's been talking about how important it is to collaborate. So one of the things we've done was we created a resource guide for our participants and for our staff. It lists all the local agencies, locations, hours, services offered, and most importantly, atmosphere. And we update it every year or more as necessary, and we try to visit every agency to build relationships and to make sure we know what services are available there. And we also make sure to give back in any way we can. We make sure that they know they can refer their folks to us, and we share resources. For example, last year, the Needle Exchange in Oakland got a donation of blankets in the winter, and they had way more than they needed. So we rented a truck and went over there and brought some blankets back for our participants. One of the ways that we give back is by conducting trainings on hepatitis for clients and staff at other agencies. The third component is the drop-in center. Our drop-in is open once a week, every week, same time, same place. And we offer all the services listed on this slide. You can see the blankets I just mentioned. I want to add that a lot of these services are not funded with research. So how do we do it? Creativity again. We partner with our local university with a program that trains medical students to work with homeless populations. And they come into our drop-in and offer acute care for our participants. Another thing we use is a program called Food Runners. It picks up and delivers warm food left over from restaurants and catering and brings it to our drop-in so that our participants get some solid, nutritious, and actually pretty delicious food. And sometimes it's the only thing they've eaten all day. The fourth component is syringe access. Why syringe access? Well, the only way for young adult IDU to prevent getting Hep C is to use sterile drug injection equipment every time. We can't give them that message, but then not give them the tools that they need to stay safe. So for instance, the young man in Newark whose needle broke off in his arm because he used it so many times, he knows that was not a safe thing to do. In that case, he didn't need education. What he needed was some sterile syringes so he didn't have to reuse the same one over and over. Also note that we also provide drug preparation equipment because these items can also transmit hepatitis C, which our participants don't often know. One study found that 37% of all hepatitis C infections among young adult injection drug users came from sharing the drug injection equipment and not the syringes themselves. Anything that gets blood on it, basically. So what if you tried everything and you really can't provide syringes? I know that a lot of places syringe exchanges aren't legal. But in the replication manual, we talk about a couple of different alternatives that you can use. If there are syringe exchanges near you, you can have an up-to-date list of those syringe exchanges and give them to your participants. You could time your drop-in to occur right before the syringe exchange or right after so that you know and you could potentially walk your participants to it. Or you could talk to the exchange and see if they might be able to open it up for 1 hour for youth only sometime during the week so there could be a youth-only exchange. If it's really not legal in your community and you don't have underground ones, you can work with pharmacies to get access to syringes. Some agencies offer their participants a coupon, and they can go to the local drugstore that the agency knows is friendly to drug users and to youth, and they can get their syringes there. Those are options. The fifth component is counseling and testing and immunizations. All of our young adult IDU participants are considered to be at high risk for hepatitis C. So we don't recommend just performing the screening test, but to do the screening test and a test in conjunction with a test that diagnoses current infection status. So at UFO, we usually conduct anti-HCV and anti-RNA, and HCV RNA. And we're also currently implementing the Hep C rapid test via finger stick, the OraSure test. And as I said, we have a video tutorial on that on our website, www.ufomodel.org. And the sixth component is an 8-week support group. The replication manual, again, has a facilitator manual that it shows how to talk to young adult about Hep C, other hepatitises, risk reduction, how hepatitis affects the liver, mental health, how relationships affect risk. And these are all topics that young adults care about and they want to know about and they like to discuss. So will young adult injection drug users attend all sections of an 8-week support group? Well, some may. You don't want to assume that they can't, but some may not be able to. So some of the things you can do is you can offer the group on a regular basis, say quarterly, so that if someone misses sessions 3 and 5, they can come back the next time they're offered and get those classes. You can offer incentives, maybe incentives that increase as they keep coming to different sessions, or a big incentive that's only given after they finish 5 or 8 of the sessions. But it's important to be flexible, to be patient, and to be creative. So we talked a little bit about how these components could be adapted in different situations. But before you're going to be adapting a model, we really recommend conducting a needs assessment, especially if your agency hasn't worked with young adults a lot, if you've worked with other people and this is a new population for you. So just make sure the changes that you're making to the model, we know you're going to make changes. We know you're going to adapt it. But just make sure the changes are based on information collected during the needs assessment. Do you really know what's going on with young people in your community, and how do you know what you know? So our replication manual can also guide you through doing a needs assessment process. And also make sure that whatever changes you make still reflect the core elements. That's harm reduction, youth-centered focus, consistency, and collaboration. And don't forget creativity. If something isn't working, just make adjustments along the way. It's also important to have a written plan so that you know and that you can explain to your ED, your staff, and your funders why it is that you're doing what you do. And this chart is available in the replication manual also. So I'm going to give you some examples of adaptation issues we're working with our 2 agencies in Sacramento and Newark. In Sacramento, they're starting to collect information about the young adults who drive into Sacramento from the suburbs to use their syringe exchange. And they know that their outreach to these young adults has got to be different, but they don't know how. So are they going to take their outreach on the road and visit the suburbs? Well, some of the suburbs are in different counties, and syringe exchange is only illegal in Sacramento County. So they can't legally bring syringes or distribute syringes in the suburbs. Going to the suburbs may require a 45-minute drive in each direction. Do they have vehicles for that? They'll need to pay their outreach workers the time that they're driving there. Do they have the resources for that? So for them, it becomes both legal and resource issues that they're dealing with. In Newark, they plan to implement the 8-week education and support group into an ongoing program that they already have with young gay black men. And they know they'll need to adopt the group, but how? So they talked about adding a session on violence and trauma, which is a huge issue that pervades the life of these young men. They also might add a session on gender identity and maybe make it open only to the young transgender women in the program. And they want to figure out how they incorporate Hep C into these sessions. For instance, the young transgender women have a huge risk. They're sharing needles all the time, injecting hormones and injecting silicone or homemade silicone. But they don't self-identify as injection drug users. I'm not an injection drug user, I can't get Hep C, but they have huge needle-related risk. So they're trying to figure out how to work that into their already existing components. So UFO Presents, we're providing TA to all these agencies to help them answer questions, and we're available to provide TA for your agency if you're interested in adapting this model. So contact us. Thanks for listening, stay safe. Also, I did put some materials about our program in the back table there if you want to take them afterwards.
Do we have any questions for Pam?
Pam, we just heard Karen describing the HEP program and how important it is to have community health outreach workers that are members of the community, live in the community, speak the same language, share the same values. Do you think that that is an important factor in a program like this? Do you need community outreach workers who are injecting drug users, who really know the lifestyle? Is that important for this model too?
Yeah, that's a good question. We talk about how to hire people who would be effective for outreach workers. So we do, in the UFO model and in other places, we have folks who used to be injection drug users who come from that community We try to hire people who are young, because if you're out looking for someone under the age 30, kind of hard to tell who's under the age 30. But if you're under the age 30 yourself, then you know. So if you're a 40-year-old saying, I don't know, how old is that person? Just ask a 25-year-old, they'll tell you. So yeah, we do hire from that community, but we don't hire current drug users. I know that syringe exchange programs have different ideas and different policies around that, but for this, there's just so much boundary issues and staff issues that we work with only people who are currently not injecting, so. And other people may do different, but that's what our model has.
Hi, that was really interesting. I just wanted to just make a comment, because years back I worked for a free clinic in Cleveland, and syringe exchange was one of the programs, and I would give them a hand every now and then. But when they started the program, I think it was late 90s, maybe you know the folks who started it, but what they hired outreach workers who were ex-drug addicts, and the way they decided on which location to have the syringe exchange van was they actually went out there on the streets and they recounted the disposed syringes in the alleys. And the two locations where they found the most syringes was where they decided to park the van. So like, you know, every day they would go at the same time to these two locations and do the program. And then so we had one on the west side, it was a Hispanic area, and then the other one in the city of Cleveland, more of an urban area. And they did hire people from those two communities. So one of them was bilingual, Spanish speaking, the other one was not. So it really, I think it really worked really well.
Yeah, definitely.
Are there any other questions? Okay, thank you, Pam. So we're going to take a break. Oh, thank you.